Welcome back to the Movement PhD. I'm Dustin Hardwick, a physical therapist with a PhD in movement science. In today's episode, we're going to switch gears. We finished up our hip unit, and now we're moving on to lumbar spine. In this first part of our lumbar spine unit, we're going to cover bony anatomy and arthrokinematics. As usual, you can find the slides in sync with the video on YouTube and Spotify video. If you're listening to a podcast with audio, you can find our slides on Substack. You can follow along. Before we talk specifically about the lumbar spine, let's review the spine as a whole. The spine can be broken up into 4 different regions: the cervical spine, the thoracic spine, the lumbar spine, and then the sacrum and coccyx. So each of these regions has a different curve, and these alternating different curves serves as a shock absorption for the whole spine. If we had a really straight spine, all of that weight would be borne through those vertebral bodies, through those discs, and they would wear out very quickly. So we have a lordotic curve or an extension curve in our cervical spine, about 30 to 35 degrees. We have a kyphotic or flexion curve in our thoracic spine, about 40 degrees. And then we have another lordotic curve in our lumbar spine, about 45 degrees as well. Then finally, our sacrum coccyx, it's fused, but it does have a kyphotic curve. So you can see that these curves are alternating in direction, and that alternate directions, that's what makes it act like a spring. So it's going to offload some of that weight to the ligaments, to the muscles, instead of just through those vertebral bodies and those discs between those vertebral bodies. Let's talk about the general anatomy of a vertebra. I'm going to use this lumbar vertebra as an example, but many of these structures can be found throughout the spine. We have our vertebral body here, the largest aspect. This is where all that weight bearing goes. This is where those discs sit. 80% of our weight bearing goes through the bodies themselves. This hole here, this large hole, that's where the spinal cord goes. So that's our vertebral canal. So this is protecting the spinal cord. We have our pedicles just lateral to that vertebral canal. So that's really what connects the body to this posterior arch. Between the pedicle and the spinous process, we'll have our lamina. So that's the posterior part of the arch here. And their spinous process. That's the most posterior aspect of our vertebra. That's what we're going to palpate if you're looking for L1, 2, 3, 4 going down the spine. Those are those spinous processes. We have our transverse processes on the lateral aspects. So again, attachment point for muscles, the most lateral parts of our vertebra. These large kind of disc-shaped protrusions on the superior and inferior aspect of this vertebra, those are articular facets. So these are where our synovial joints between the different segments are. So the superior facet, it's going to articulate with the segment above this vertebra. Our inferior facet, that's going to articulate with the segment below it. So those are our major structures that you're going to find throughout the spine. This is a lumbar example, but many of these you're going to find in cervical. You're going to find them in thoracic as well. Let's talk specifically about our cervical vertebra. So what's unique about a cervical vertebra? For one, we have these holes here on the lateral aspect. That's where our vertebral artery runs. So those are there to protect that vertebral artery as it runs down the lateral aspect of that spine. Some other unique features, we have our bifurcated spinous process. So you have this kind of V shape here. Those serve as attachment points for muscles. The other unique things, we have these uncinate processes. So the body forms kind of a U shape. Those uncinate processes, they give lateral stability to that cervical spine. And the final thing that's unique about cervical spine, you see these articular facets that are sitting on the superior and inferior parts of this cervical vertebra. They're very large compared to this rather small vertebral body. So when you have a large facet and a loose capsule, that allows a lot of motion in that cervical spine. So if you think about the cervical spine, what's it need to do? It needs to move our eyes throughout the workspace. So having a lot of motion in that cervical spine is a functional advantage of those large facets relative to the size of the body of that cervical vertebra. These facets, they're sitting at about a 45-degree angle. So they're 45-degree angle between the transverse plane and the frontal plane. So they're sitting about 45 degrees. That allows them to have that rotation a lot of rotation range. It also is the reason why there's a coupled pattern between rotation and side bending of the ipsilateral direction of that cervical spine. Let's next talk about our thoracic vertebra. So what's unique about our thoracic vertebra? They have the spinal process that's pointed down, so inferior, so that supports that spine into extension. The articular facets, they're in the frontal plane. So a frontal plane articular facet, that's going to prevent a lot of sagittal plane motion. So not only extension, but it's also going to prevent flexion. And we want to prevent flexion in that thoracic spine because we have all of these organs inside our thoracic cavity, heart, lung, all those different organs. If we flex too much, that would impede on the space available for the lungs and for the heart. So that's why having those articular facets in that frontal plane is functionally important for thoracic spine. The other thing that's unique about thoracic spine, we have demifacets on the body and we have facets on the transverse processes. Those articulate with the ribs. So the ribs are another reason why there's not as much motion available here in that thoracic spine as cervical spine, as lumbar spine. Finally, we have our lumbar vertebra. So what's unique about our lumbar vertebra? Really, it's the size of that vertebral body. Most of our weight bearing comes down through that lumbar spine. So having the large vertebral body supports that weight and allows for a rather large disc to support that weight as well. Some of the other things that are unique, the articular facets in that lumbar spine, they're close to the sagittal plane. So if we have facets that are in that sagittal plane, it's going to allow for flexion and extension, which the lumbar spine has a lot of that motion available to it, but it's going to prevent rotation. So having the sagittal plane orientation, preventing that rotation is a good thing, because one thing that's really bad for intervertebral discs is putting a lot of load on them and twisting. So we want to have our lumbar vertebrae protect from too much rotation or too much twisting. So that's really some of the unique features here of that lumbar vertebra. I alluded to this a little bit as we discussed each of the different vertebra, but really most of your motion available in the spine is coming from that cervical spine and a little bit from that lumbar spine. So in green on this graph here, that's our sagittal plane motion, so flexion and extension. You can see that the most of that is coming from cervical and those lower lumbar vertebra. And you can see in at least the upper part of the thoracic spine, the part that's close to those lungs, close to those hearts, there's not a lot of sagittal plane motion. And that's because of the ribs and that orientation of those facets in that thoracic vertebra, which are close to that frontal plane. Rotation, you can see that most of that is coming from cervical. And that makes sense because our spine is designed to be functional. And what's the function of the cervical spine? It's to take our eyes and move it throughout that workspace. So I want to have a lot of that range of motion into rotation coming from that cervical spine so I can scan the area around me. I can look for objects that I then can use my hands to go manipulate. So really our cervical spine is to take our eyes and move it to a target so then we can move towards that target. So most of our rotation is coming from that cervical spine, a little bit from thoracic, very little coming from lumbar, just because there's so much load in that lumbar spine that you don't want to put torsion on those discs under a full load in that lumbar spine. Lateral flexion, again, most of that's coming from our cervical spine, with a little bit coming from the rest of the spine as well. So in general, we don't have as much lateral flexion as we have other movements, and most of that's going to be coming from our cervical spine. Don't memorize the absolute numbers on this graph. Appreciate the relative amounts of motion in the sagittal plane, in the horizontal plane, in that frontal plane. Let's review the ligaments that support that lumbar spine. The most anterior ligament is the ALL, or the anterior longitudinal ligament. It's sitting on the anterior aspect of those vertebral bodies. So it prevents the spine from going into too much extension, and it also supports the anterior aspect of those intervertebral discs. On the other side of the vertebral bodies, we have our posterior longitudinal ligament, or our PLL. So it's going to prevent flexion, and it's going to keep that disc in place on that posterior aspect, or support the posterior aspect of that intervertebral disc. We have our ligamentum flavum, which sits along the spinal canal on the posterior aspect. And again, it's going to limit flexion and just provide a continuous canal between those vertebral segments. We have our interspinous ligament, which is between the spinous processes. So inter means between, spinous, so it's the ligament between the spinous processes. Again, it's a posterior ligament, so it's going to limit flexion. Just posterior to that, running along the tips of those vertebral, those spinous processes, we have our supraspinous ligament. So supra, above spine. So supraspinous ligament is along the tips of those spinous processes. Again, it's going to constrain or it's going to limit flexion. The final ligament is the capsule itself around those facet joints. So remember, those facets are articular, have articular cartilage. They're synovial joints with articular cartilage and synovial fluid. That capsule, or that facet capsular ligament, surrounds each of those facet joints. Those facet joints are plane joints, so the arthrokinematic is sliding, and they're surrounded by that facet joint capsule. So what is our function? It's to keep that synovial fluid inside that facet and limit the extremes of motion. I'm now going to talk about the arthrokinematics of that lumbar spine. We're going to start in the sagittal plane, and we're going to start with flexion. So flexion, again, is a sagittal plane motion which the body moves anterior. So flexion is bending forward. So what are the arthrokinematics involved in flexion of the lumbar spine? Well, the vertebral, we're always going to name our motion as the motion of the superior segment moving on the inferior segment. So it's always going to be motion of the superior vertebra on the vertebra below it. So in flexion, that superior vertebra is going to tilt anterior on this vertebra below it. With that tilt comes an upslide of the inferior facet of the superior vertebra. So again, named by the superior segment. As it tilts anterior, we're going to get an upslide between those articular facets. So what are the things that are going to limit flexion? It's going to be all of those posterior structures that we talked about in the previous slide on ligaments. So supraspinous ligament, interspinous ligament, also the muscles on the posterior aspect. So your lumbar extensors are going to prevent flexion as well. What are the forces on those intervertebral discs? Because that superior segment is tilting anterior on the one below it, you're going to get compression on the anterior aspect of that intervertebral disc, and you're going to get distraction on the posterior aspect of that intervertebral disc. Now let's talk about the other sagittal plane motion, which is extension. So again, extension is moving your body posterior in that sagittal plane. So to get extension, we're going to get a posterior tilt of that superior vertebra on the vertebra below it. So with that posterior tilt, we get a downslide of the inferior facets of that superior vertebra. So to say that again, the superior vertebra is going to tilt posterior on the segment below it, and that's going to be a downslide of that inferior facet of that superior vertebra. So what are the things that limit extension? So it's going to be those anterior structures. So that ALL, or that anterior longitudinal ligament, plus those muscles on the anterior aspect of the body. So our rectus abdominis is going to be the main muscle that's going to limit extension of that lumbar spine. Let's now talk about transverse plane motion. So what kind of motions occur in that transverse plane? They're rotations. So rotation to my right, rotation to my left are all examples of transverse plane motion. When I rotate to my right, the vertebral body of the superior vertebra is going to rotate to the right. However, the spinous process is on the posterior aspect. It's behind that center of rotation. So as the vertebral body rotates to the right, that spinous process goes the opposite way. It goes left because it's on the posterior aspect of that spine. Because of that, we get compression of the two facets, the inferior facet of the superior vertebra and the superior facet of the one below it. we get compression on the left side, we get distraction or separation on the right side. So let me say that one more time because it can be kind of confusing to keep track of your rights and lefts. As I rotate my body to the right, the spinous process is going to go left because it's on the posterior part of that vertebra. Therefore, the facets on the left side are going to be compressed or approximated, and the facets on the right side are going to be separated or distracted. Let us move on to frontal plane motion. Frontal plane motion in the spine is going to be lateral flexion, or side bending is another way to say that. With lateral flexion, the superior vertebra is going to tilt to the direction you're laterally flexing towards. So if I laterally flex to my right, you're going to get a tilt of that superior vertebra to the right. So with that, you're going to get a downslide of the vertebra on the right and an upslide of those facets on the left. Let me say that one more time. As I laterally flex to my right, we're going to get a downslide of the facets on the right and an upslide of the facets on the left side. So what are the structures that limit lateral flexion? It's going to be those intratransverse ligaments, so those ligaments between those transverse processes, and the lateral muscles of the body that you're bending away from. So it's going to be our obliques and our QL on the left side if I'm laterally flexing to my right. Let's talk about the compressive forces that go through that lumbar spine. About 80% of our body weight, those ground reaction forces, the weight of our head, arms, and trunk, those go through the vertebral bodies and that intervertebral disc. So between each of those segments, those vertebral bodies of the lumbar spine or throughout the whole spine, you have an intervertebral disc. It is fibrocartilage rings surrounding a nucleus. Those fibrocartilaginous rings are the annulus fibrosus, and we have that gel or that nucleus on the inside. So 80% of our body weight is going through those discs. The other 20%, those are going to go through those articular facets, or those zygoapophyseal joints. A zygoapophyseal joint is the same thing as a facet joint. In the lumbar spine, if I'm just standing, I'm not walking, I'm not jumping, I'm not doing anything, the compressive loads on those vertebral bodies, that intervertebral disc, is about equal to my body weight. So that disc loses water as we age, so that by the time we get to a geriatric age, we've lost 35% of the fluid content in that disc. So that is one reason why as we age, we get a little bit shorter because we lose some water in those discs. So they're less plump. So we lose some height in each of those discs. It's not a lot of height in any individual disc, but if you add it up across the whole spine, you lose some height with that. You also lose some water towards the end of the day. So if you want to make yourself maximally tall, you want to measure it in the morning before gravity has pushed water out of those intervertebral discs. Let's break down that intervertebral disc a little bit more. So in the middle of that disc, we have our nucleus, which is the gel-like consistency. It's there for shock absorption. Around that nucleus, we have concentric rings of fibrocartilage, which makes up that annulus fibrosus. The orientation of the collagens in those rings is 45 degrees, and they're perpendicular to each other. So in layer A, we have cartilage in this orientation, so 45 degrees this way. The next layer, it's opposite. And then layer C, back to the opposite again, layer D. So they're concentric rings where the cartilage is perpendicular to each other. So what's the advantage of having that collagen arranged in a perpendicular fashion that's 45 degrees from the long axes of the vertebral body? It's to resist rotation. And I need them to be perpendicular because I need to resist rotation in both directions. So that's why we have these alternating rings with opposite fiber directions. The other thing it does is it creates a lattice work. So if we have fibers that are crisscrossing one another, that provides more stability than if they were straight up and down or they were horizontal. So it's there to give it some additional toughness and also to prevent that torsion, because torsion is really bad for those intervertebral discs. Let's discuss the relative compressive loads in the lumbar spine across a few different postures. So if I'm just standing and I'm not moving, I'm not walking, about 1 times my body weight is on that lumbar spine, so L3, L4. If I'm laying down, that's going to have the least load because now I'm perpendicular to gravity, so gravity's not putting on any compressive forces on my lumbar spine. Only the passive tension of the muscles are there, so that's maybe 30-ish%. If I'm sitting, it's actually more than standing, which seems counterintuitive at first. But remember, when you're sitting, your lumbar spine is going to lose its curves. So if it loses those curves, those that we talked about in the first slide, then we lose that balance between the 80% through the disc and 20% through those facets. So now most of that load is going through the discs themselves. The other thing by losing the curves is now we're taking those forces that were on the ligaments, that were on the muscles when we have a nice curve, and now we're putting straight through those vertebral bodies. So sitting is actually a more compressive posture than standing. If I'm standing and I bend forward, I'm going to lose the curve in that lumbar spine. I'm also going to increase the moment arm of the weight of my body. So we're going to get an increase in that load if we bend forward. And the absolute worst thing you can do is seated and hunched over with slouching with poor posture, which in today's world where we have a lot of devices, phones, iPads, and we're on them all day, we're in this posture a lot. When we flex further from a seated position, not only do we increase the flexion of that lumbar spine, so again, more of that weight through that intervertebral disc, we're also taking the moment arm of the weight of our upper body and we're placing it in front of the spine. So that's going to increase that moment arm, increasing the forces on that lumbar spine. So sitting and slouching is the absolute worst thing we can do with loads on that lumbar spine. Let's talk about the anterior shear forces on that lumbar spine now. So remember, lumbar spine has a lordotic curvature, so it's in some extension. Because it's in some extension, the vertebral bodies have a moment of force in the anterior direction because they're wanting to slide forward on the vertebrae below it. And you can see in this image, the more lordotic curve you get, the more force is going anterior. So it's normal to have some anterior shear forces in that lumbar spine. But when we start to talk about different postures, if we have an increased lordosis, so we have that anterior pelvic tilt, that hyperextension of that lumbar spine, then we're going to increase those shear forces even more. And what happens when we increase the shear forces of that lumbar spine? Well, we can break through the pars interarticularis. So the pars interarticularis is this bone between the two articular facets. So let your words help you here. It's interarticularis, so it's between the articular facets. So when we get an increase in those shear forces in lumbar spine, we can get a break through those pars, and that's going to be a spondylolisthesis. And we'll talk about that in greater detail when we talk about some pathologies and movement things related to that lumbar spine. I want to end with a review of the arthrokinematics of the lumbar spine. So remember, when we're talking about movement of that lumbar spine, we're talking about the superior segment moving on the inferior segment. So L3 moving on L4 or L2 moving on L3. So during flexion, L3 is going to anteriorly tilt on L4. And with that anterior tilt, you get an upslide of the inferior facet of that L3 or superior vertebra. So what are the structures that are limiting that flexion? So it's that interspinous ligament, it's that supraspinous ligament, it's those lumbar extensors. So all of those posterior structures are going to be limiting that extension. What are the forces on that intervertebral disc? It's compression anterior and distraction posterior. Moving on to extension, also sagittal plane motion. With extension, we get a posterior tilt of that superior vertebra on the one below it. So with that posterior tilt of that vertebra, we get a downslide of that inferior facet of that superior vertebra. What are the structures that limit extension? It's the anterior structures. So that anterior longitudinal ligament, those abdominal muscles. Next up is transverse plane motion, so rotation. So with rotation, you have rotation of the superior vertebra on the one below it. So we have rotation of L1 on L2, or rotation of L2 on L3. So remember, with rotation to the right, the vertebral body is going to be rotating to the right, but that spinous process is going to go to the left because it is posterior to the rotation point of that spine. So therefore, the arthrokinematics of rotation is compression on the left and distraction on the right for right rotation. Let me say that one more time because I think this is probably the most confusing one. With right rotation, the spinous process is going left. Therefore, we get joint approximation on the left and joint separation on the right. So what limits rotation? Well, the approximation on that left side is going to stop it from rotating because we have those facets in that sagittal plane. So once that left-sided facet's compressed, you can't rotate any further. Also, the capsule on the right is going to be under some distraction. So both of these things are going to limit rotation. Also, the abdominal muscles, those obliques that are involved in rotation, they're going to limit that rotation as well. Our final plane of motion that we're going to review here today is frontal plane motion. So remember, frontal plane motion is side bending or lateral flexion. So as I laterally flex to my right, I'm going to get a downslide of that inferior facet of that superior vertebra because that superior vertebra is going to tilt to the right. So therefore, with a tilt to the right, you're going to get a downslide on that right. On the opposite side, you're going to get an upslide. So we're going to get an upslide of that contralateral facet. So what are the things that are limiting motion in lateral flexion? That intertransverse ligament, so that ligament between those TPs or those transverse processes at the spinal level, and all of the muscles on the lateral side of the body that I'm bending away from. So with right lateral flexion, that's going to be limited by my left QL and my left oblique muscles. Thank you for joining me for this first part of the lumbar spine unit. Today we reviewed the anatomy of the spine as a whole. Then we reviewed the anatomy and arthrokinematics of the lumbar spine. On our next episode, we'll cover the muscles that move the lumbar spine. Thanks again for watching, and I'll see you next time.